we get the Minister of Health, Dr. Sindembi, where we can talk about the 90 days inside the implementation of the 300 days of activism on maternal and child health. But with that, I want to say good evening and welcome to our studio guest, Dr. Sindembi.
Kaifatu, good evening. Good evening to all the Salon people.
Okay, and Fambu Youssef can add the voice span the program by where you go ask questions or make contributions or complaints where you go and for make the Minister of Health know. The number for call now 077-981-981. The number now 077-981-981 where we go open with phone line later on inside the program. Also, people go call and ask questions about the 300 days of activism on maternal and child health. We're on 90 days now. Wetin you want for nobody implementation and wetin are some of the things that we government don't do, you go call later on at the program on the number 077-981-981. So Dr. Dembi, the 300 days of activism do 90 days. So wetin no start for look at wetin lead to this implementation of the 300 days of activism.
So actually today na day 93.
Okay.
With the track actually today right now the talk so na 93 days, 6 hours, 53 minutes, and 7 seconds. We did track every minute of this 300 days of activism. What do we find out na Salon? Salon don't get the record for get the fastest drop in maternal mortality over the past years. Again, with no sedan they happen because of the incredible effort where all man they put span at the whole country. But even at that, we don't go from a measure of 1,300 per 100,000 live births. It don't come down to 717 per 100,000 live births. It come down to 443. It come down to 354. So with all them drop here, so we know seeing a deliberate effort on the part of Salon people to make it count down, but you still get a high number. So that 354 now from 2023. So we don't decide now, say no, we don't agree for that. The president don't give a clear warning, say every belle woman important to we. So for we, the best approach now for say, now this country, zero, no belle woman not for die because of something we supposed for do, will not do. Zero, no picking not for die in this country because of something we supposed for do, will not do. Number 3, zero, no picking up for dinner this country. We forget immaculate in not get them because we not offer them. So now that we get this campaign of 300 days of activism for 000 000 zero preventable maternal deaths, zero preventable child deaths, zero those children.
Before government's been come up with this initiative on 300 days of maternal and child health, Lord take you back to the data or statistics of belle woman and where they die in the country.
So as I say, Salon is sad. It really is sad because Salon have been the one country where get the highest maternal mortality in the whole world. The whole world. We will be register about 1,300 per 100,000 live births. The second country to we've been register about 800. Imagine from 1,300 to 800. So no one have been there close to it. Again, boku factor then may lead to that. But now, as we see, first any side where you go, we say you come on Salon. If you didn't have the health sector, then they ask you, hey, now that country who said them below man and they die. Then they tell you, say, this is not the worst place, not the world for the woman, they let it get belly. Now, that one they don't change. That one they don't change because Salon get the fastest drop in maternal mortality in the whole world. And then they, as I say, as a result of we collective effort, everybody come together, the well body business and the community, the society, we all say it's unacceptable for let anybody die where they bring life. And we also say it's unacceptable for all the new life here all they bring, let them pass away prematurely. We no agree for that. Now the fact they ban so.
Okay, inside these 300 days of activism, now for starts for GUI and updates on waiting are some of the things where the ministry don't they do, 4 make we go get zero maternal deaths in the country.
So now this nine and call all of society effort. Everybody important. So for the well body side, we dey make sure say first we get facility then we ready for managed pregnancies. At the same time, we get staff them. We trained appropriately for able for deliver baby safely. At the same time, we get physical infrastructure, theater them, medicine them. We go allow we for able for deliver safely. So we dey create that environment. Say if you can't inside with hospital facility, we go able for help you. Secondly, we not dey wait for crisis. We dey make sure say if we able for see or meet the beleoma early, we dey register the pregnancy. We don't develop one new app now we then call Combra app. The Combra app they allow you for register the pregnancy. If you don't register the pregnancy now, the whole health system don't know say you there. And we on roll now not for wait till labor and delivery. Then get what they call antenatal care, the engagement we they get with the hospital before you born. So usually as you done 2-3 months now you don't she say you get belly can hospital, then get antenatal care within they deal with you. Then they deal with you normally, then they say count 4 visits before you deliver. Now we don't say count 8 visits. Every visit where you come, we they look see, hey, wait, this woman get high blood pressure, let we manage them. You get diabetes, let we manage them. You get other underlying condition, then law manager. You get sickle cell law manager. Now twin they carry, now triplet they carry, now quadruplet they carry. Let we know in advance so we before manager. So if we know all anything about this pregnancy now, we dey make sure say this pregnant woman every encounter we dey check all aspects of her. We dey make sure say you no get malaria. We dey make sure say you no get typhoid. We dey make sure say you get nutrition, you no get malnutrition. You get all of the ingredients them. We go prepare them for labor and delivery. And we want let all the delivery there occur inside hospital so that we will get full control and make sure say the baby come out safely. That's not to we own side.
Okay.
Now to the community they own side. The community will they ask say every pregnancy now we all get them. We all get for support this pregnant woman. If you're not chief, if you're not community elder, if you're not granny, if you're not uncle, if you're not auntie, if you're not brother, if you're not pikin self, you need for day for support this pregnancy so that if the woman ready for can hospital, we make sure say it can dey. If the woman get nutritional problem, then the whole family support her so you get much more nutritious food. We make sure say the woman not stress, the woman not they go through a difficult time. If we community them, then work closely with the hospital them and surround ourselves around this pregnancy and monitor all of this pregnancy them to term. Me I know say no belle woman no go die because of something we supposed to do or not do.
Dr. Lemmy, you talk about the press track app where we call the Comra app where now one way the ministry be don't implement for the keep health record of any Comra or belle woman where they go na on hospital. This app they work now all the districts them.
So the 300 days they give you chance for move this app because we've known the test and force now app. Now record system, because the economy you go outside, you get bugged there inside you need for correct, we need for say. But you don't get in a perfect state now. So now with the move on, we try and force about 2 or 3 district them, and we don't say it don't work well, we don't perfect them. DSTI, one of we partners and they help we for develop this. So they don't turn over the whole app now to the Ministry of Health. What do they do? They use these 300 days for make sure so we apply it throughout the whole country.
Okay. So, Dr. Dembi, now you talk of community support for get to belle woman them. So, how don't they work with the paramount chief or local leaders then at the different districts them, like for instance the one way they make belle woman they born a house for say una get a bylaws where go say then tap people not for make woman they born na house.
So the bylaws now one of the biggest instrument and tool that we get at our disposal. But say bylaw now something Now the authority of the community, they all they come together and decide, say, hey, this now the new rules where they bring come, where they ask everybody for abide by. They use the paramount chief in authority, you use the community elders, the authority, for make them lawyers. So then lawyers are supportive law. It is encourage, it is support, it is beg all of the Bella woman and let them come hospital for Cambon, let them come hospital for clinic. Because what's in happen, you go feel say, oh, that's all been on there for the past 500 years with the born now host the Bondo people and the Sui, then they manage the thing, the traditional birth attendant, and they manage who all na they we born. But if you didn't host, they became breach. That means say the aid not come out, the food come out one time. What you go do? If you didn't host, you get complication around the pregnancy. What's in for do? If you didn't host, you get ectopic pregnancy with the picking the grown at the wrong side of the uterus. What's in for do? So it's really important for bring this person kind of hospital. The bylaw them now law we enforceable, but it encourage not so police law. Now community law for encourage people and for come because you see the benefits when you come. If you not come, the chances say you will get problem now is very, very high. And we get problem now now that's a all man they scramble. Look, the kind system what they build now, we they make sure say we minimize emergency. Because if you come early during the antenatal care, with this press track don't give you the opportunity, we don't know you. We know you side day. We know how your health status day. We they monitor, we they work with you on a daily basis. So surprise no good day. The surprise can happen where you don't know where the woman come born the first day this year you get high blood pressure all this while. Sometimes the blood pressure don't make something on bust, something don't go bad pan the baby where you don't know. So you don't know sometimes the high blood pressure it don't make sure say the woman not weak and able for deliver herself. You don't know if the person can get diabetes where you unmanaged, we able for make sure say you able for carry on this pregnancy to term. So we want to avoid all the emergency then I make we use press track for register you, but more importantly, for you can antenatal care at least 8 times before your delivery. And we ask all man, including the chiefdom, including the community elders, for support that pregnancy for they come in. The bylaws now just additional support for make sure say you encourage people and for come. And if you don't come, they can get fined within the unit. But now small fine them more as an incentive for bring you come than for punish you for your pregnancy.
Okay, Doctor, then be another thing again where concern don't they come up from people now that especially in a remote community then at the distance, no they get access to medical health facility because then they say that they work a miles for go na starting for go make them go the antenatal for go get antenatal care and other concern where people they get. I think say that now other thing challenge where make some people not they even forgo, then some people can decide and born a us.
Yeah. So now very, very important in now access to services. Salon, we don't know no more, but now one of the best countries in the region for access. 85% of the population get a facility within a 5-kilometer radius. 85%. So we biggest challenge now, what me they work on now for make sure say when you create access, it can with quality. For we the quality means physical infrastructure. The place get for be fine, it get for be some way person one go, it get for be clean, it get for be tidy, it get for get electricity, it get for get water. Secondly, for you provide quality, you get for get staff and staffing complement the different kind of staff them in the right numbers and with the right attitude for provide service. Third, you can forget supply chain. You can forget the medicine and the commodity that they need, when they need her, how they need her, and affordable. So we get all the things in there, you don't able to provide access with quality. It encourage people then for utilize the service. So we they try for minimize the distance where people can get for travel. Again, but I say we they do very, very well compared to the sub-region, but it's not good enough. Everything that happen back, they get population shifts. Village, then they become town. Town, then they become cities. Hamlet, then they become villages. So the population, they move around. We dey try for see how we will for build new facility there as close to the people as possible. But for me, one of the delays where people encounter are the distance, okay. But more importantly, it's really critical that people then come early. Where you well, we detect say you don't pregnant. Come, let we work with you. As we work with you, if it be say na complicated pregnancy, we dey make sure say an OBGYN, an expert involved in your case management. If it be say na normal pregnancy no more, we go make sure say we able for access the facility early. We get ambulance services there now. The ambulance, I say ambulance service, not to just the ambulance, not to just the motorcar. The motorcar don't mean much.
So if not only motorcar, now waiting.
Waiting inside, what do they say? Now the motorcar, plus the equipment then with the inside, plus the staff then with the day, plus the communication where they go on between the motorcar and the hospital. So now that now don't establish in the country now the ambulance system, so that inside we know side all of the ambulance then distributed in a strategic location. If you call the 117 number, we then pick up that number they call, then they know exactly who side you call from, they will know exactly who side the closest ambulance there to you, they will know exactly who side the closest facility there, then go able to coordinate between the facility, the ambulance, and you for ensure say you get safe passage. And when you go inside the ambulance, even before you go inside the ambulance, your care don't begin.
Doctor, then sometimes can they delay on that 117 line. So is it that the ministry not go able for make ambulance go there now all the different hospitals them or PHUs them?
So the ambulance is strategically located. First them, then they say, Lord, give this chief town one ambulance. Lord, give this town one ambulance. Lord, give them community one ambulance. Where you give them the ambulance, then they pull Bono Devil, then pull Kaka Devil, on man dance. The day we one tire bus, the ambulance don't park. The day the one windshield bus, the ambulance don't park. So what you they do now, we get over 100 ambulance them. We they make sure say every ambulance is fully fueled at all times. Every ambulance, it get multiple driver them we dedicated to them. Every ambulance gets staff, medical technician with they on board. Every ambulance get the right life survival equipment with the inside. So again, we they look this model, but lately, you don't hear people complain about ambulance. First them, no week no they pass where they know they say this ambulance they ask you for petrol. The ambulance not come back. The driver not they somebody they take what they call the driver, the ambulance they take passenger. This new system will create will get complete new management, new structure. Now we build. In fact, right now we're in the process of building a depot for the ambulance them so that they routinely maintain them on a regular basis. So I think say we'll go walk on that ambulance, but Lord move away from, because anytime you go, where will your ambulance?
Okay.
Lord not worry about me own ambulance. Lord ensure say ambulance service day for all man.
Continue for the between the program and name now Dr. Stindembi in the Minister of Health. As in that so today for talk about the 93 days inside the implementation of the 300 days of activism on maternal and child health. The program na special body talk on maternal and child health where the Ministry of Health they support for being come to now. Fambul now you go call the number 077981981, 077981981, and the number where you go call and ask questions. Also, if make contribution as we get the Minister of Health, Dr. Stindembi, we will respond to our concerns them. The number for call and be part of the program now 077981981, 077981981, and the number for call and be part of the program. We don't get to first call at the program. Hello, good evening. Name and who the call from?
Good evening, ma. How do you be?
Good evening, sir. You name and who the call from?
They call from Tonkolele for intersection.
Okay, sir. Go ahead. Okay.
Yeah, the tax for the minister, which he don't talk, all would I hear. But all have small thing. The 3 days activities. You don't say the CHW where they had it, had to reach area, are able to motivate the patient for they go to hospital. So the CHW like that the role model for let he talk to the 3 days activities, now able to talk to the patients there for let them go to hospital. The hospital now, they will work confirm. So now your contribution than it.
Okay, plenty. Thank you for that contribution that we make na the program. This na special Well Body Talk program where the Ministry of Health dey support for begin camp to now on the 300 days of activism on maternal and child health. The number for call and ask you questions or concerns or contributions wey wa make na 077981981 077981981 and the number where you go call and ask you question na the program as we get the Minister of Health, Dr. Austin Dembi, we go able for respond to now. So, Dr. Dembi, now this one they talk on the 300 days of activism on the role of healthcare practitioner for raise awareness na different community then for make people then they go. So, let's pick this other call again at the program. Hello, good evening. Name and who the call from?
Hello,
Okay. Please come on your radio, sir.
Okay. The concern is that the hospital they don't get that much care for the patient. Then there are a lot of problems with high blood pressure.
Okay.
People that they die from high blood pressure, they love in this community because advice not they when they go to hospital, they give them 2-3 tablets. They not they give them advice or make them they make a follow up, even for make them check their pressure. That problem. So
Now which community they call from?
Na Bonum we are.
Okay.
So the PHU they not get that much care for the patients then. And make most of the people then who then get high blood pressure in this community, then they die. So that is my concern.
Okay, plenty. Thank you for that concern. Say we make na the program. This na special Well Body Talk program on the 300 days of activism on maternal and child health, where the Ministry of Health they support for bring camp to now. You self can add the voice for the program, or I go call the number 077981981. As we get the Minister of Health, Dr. Austin Dembi, we go respond to a concern or question. We na the raise na the program. More calls inside the program. Hello, good evening. Your name and who the call from?
Good evening, how you doing?
Fine, sir. Your name and who the call from?
I call from Wednesday. We get even some human deliver on our community center. The nurses the way they not care. No man in for room. These people they focus on phone. They self and are willing to perform community center. The last time they go give me picking my clip, right now I'm picking food in the tremble. Then he hand the tremble together. At the good day, there is no response. What's to that one day? So this right now, I are very, very more confused. What's to that one day?
Now which hospital dan dey, sir?
Now community center by Wellington.
Okay, plenty. Thank you for that concern the way you use na the program. Okay, Dr. Dembi, you can respond quick to that. I know say more calls they come na the program. We still they get calls anyway.
Yes, first the caller from Tonkolili. I get Tonkolili is one of my favorite places there. I go my broker. Why I just come back and make me minister. I go there, I see one of the cleanest hospital in the whole country. I mean, the Magboka Government Hospital. So again, I hope they're able to maintain that standard there. But the caller say the role of community healthcare worker. Community healthcare worker then critical, then vital. The doctor they not there for they near the patient within their house. The nurse they not there near the patient and within their house. Now the community care worker then they very very close to them people there, and then they help them for navigate for car hospital. When they come out hospital and go back, now they hand them people are so they left. The picking them, the mother them, the adult them. Again, we so indebted to community healthcare workers. The biggest problem we'll get, they're not organized as a structure. They're not feel that the doctor that we get union, we get category, we get promotion capability. So what should they do now for re-engineer, restructure the community healthcare worker them so that not the volunteer no more. We'll pay them a reasonable allowance and give them some of the tools that we go allow them for get them work and let them partner with the facility, with the institution. And so now good partnership between the community healthcare worker and the doctor there and the nurse and at the hospital. Strong partnership, if we're able to succeed on these 300 days, it counts on the hospital as well as the community. So we encourage all the community healthcare workers. In fact, we get a small meeting with them for see how for work with them and strengthen them as an institution. On the issue of high blood pressure, where the caller from Bunubu State, this is now a big problem now the whole country, now the big problem now the whole continent. Because high blood pressure, they know, see you get high blood pressure, yeah? They show itself in signs easily until you get crisis. And what's happen now with the CCA, if you not control your high blood pressure, one day the pressure goes so much that it burst the blood vessel in your brain, and which you get stroke. If you not manage your high blood pressure, sometimes they burst the vessel in the kidney, you get kidney failure. At times, if you not manage your high blood pressure, it burst the vessel in your eye, then you get a little blindness. So high blood pressure now major problem for we in this country. If you wait till you come to hospital with the end result of high blood pressure, it's on too late. So high blood pressure now for men now hospital and now us. For prevent now us. Waiting they cause high blood pressure. Now when you get weight where the body don't big pass mark, the heart they fed so hard for pump the blood. Now they cause that problem there. Again, if they eat past mark salt and maggi, it make the blood they thick, it hard for let the blood pump, so the blood they struggle for them. If you know they exercise now us, the blood not they move properly, it lead to high blood pressure. So we all in canteen and they if you know they eat properly. So if you know they eat, they exercise, all in they lead to high blood pressure. So waiting for do, if you come to hospital early, especially man them, well not to man them no more woman. Man them no like for go hospital. Woman they can go hospital because of them picking and themselves. But if you come early, you get an opportunity for let them take your blood pressure, but let them give you counsel and guidance. But who tell the way you don't need it for take medicine for them. You can do some lifestyle changes. You reduce your salt intake, you exercise, you reduce your weight, you able for eat properly. You make sure say you not eat late in the night. If you do all that and then you able for manage your blood pressure. If you be say you don't get problem now with the blood pressure, you're able for manage them, then get medicine. If then start the medicine now for your whole life, you get for take the medicine. So it's better for prevent them than for treat them. But if you need for treat them, medicine and then now, but just not say we take this medicine now for the rest of your life, you get for take them. We find out say this is a big problem from them boss them moving it, the hospital on wheels. With the hospital on wheels, they go now some community, go park. A lot of the people that when they come, we see all kinds sick there, One of the commonest one then, high blood pressure. So the people they don't know. But when they see the boss then candy, then check them blood pressure. They tell them they know see for the first time, and then get high blood pressure. And what you will need for do now for work with this patient here, so link them to the local clinic for their long-term care, but also give them the counseling and support where they need for ensure, say, you able for prevent high blood pressure, but if you get them for able for manage them. The third person, we from Wellington, we say the nurse, they know they take care, the nurse then they on their phone. We get a very formidable health workforce. The nurse there and the doctor then they try under extremely difficult circumstances. But some nurse then they, some doctor then they do well. So what you they try for do, we as a ministry, me as minister, me not a referee for sit down say, hey, you dey do well, you know they do well. Me not coach. The one that we know they do well, we they work with them. We they give them the requisite training. We give them the requisite orientation. We they support them for let them do well. If we try, we do all kind of way they not do well. Community they still they put say, then people are not they do well. We they ask them let them left. But again, we're in a very critical stage now where they provide all of the tools for we nurse there and we medical practitioners let them give high quality service. In fact, this BNTM will link with the University for Health Equity in Rwanda for can teach we medical people and the hospital administrator and the hospital manager, the hospital superintendent, them, how for run their hospital, how for care for their staff, how for manage their staff, how for bring the ethos of service to their staff. So all the things that they go on, and we be convinced that the ministry say, we number one boss them, now the people that all they serve. The only person we could tell you say you don't do well or you don't do well, now the community where you serve. So if we either report your say some nurse and not they do well, we go work with the medical superintendent, we go work with the district medical officer for identify them and train them and support them. If you're not right, you better let them be outside of the system than let them be inside the system, then they provide the kind of quality service. Again, this is not minority. This is not very, very few people that do that. Most of the people then they dedicate their life to the service of the patient.
Okay, we will look more onto the attitudinal change of healthcare workers then. So the one of the key components on the 300 days of activism na 00 dose children. But Dr. Dembi, the malaria vaccine for under 2 Pikin not available now Western area urban.
So Lord talk about the zero dose children, yeah. So we they say non-Pikin for in this country, we supposed to forget marklets, we forget marklets, we not getting marklets. So the zero dose children are picking and they will one day not get any marklets. We'll begin this year so now being about 9,000 of them. First year being something like 14,000, Umbrian contain 9,000. But inside this 9,000, inside the first 93 days of we effort hold on the work, guess what? We don't reduce the number of picking them. We not ever get vaccine by nearly 50%. Yeah? Right now, we don't reach about 4,894 picking them by the 9,000. We're now about 54% of the picking them inside the 300 days. Inside the first 90 days. So we did on a really good cause.
This data cover picking away then add to reach here then.
So this data is deliberately intended for hard to reach areas. Okay. Because now then no one day gets marklets. We look at then cattle herders, then people that were in our distant communities, then people that were within our bush area where they're not able for car hospital. We estimate and do the WHO estimate. We say you get about 9,000 of them, 9 none left. Now we don't reduce that to less than 5,000 in just 300 days, in just 90 days. So we defend all, which now with the dynamic would they say zero. We defend all them picking in it, no matter outside in the law give them the full dose of vaccines because quite frankly, it's not fair, it's not right for let anybody die of a vaccine preventable disease when the vaccine is available. So I'm concerned that the malaria vaccine not there in a particular place. I go follow up on that and go find out also there. But again, the malaria vaccine not a silver bullet. Yeah? The malaria vaccine may be 50% efficacious, enough by the one and we're 98%. But what's happening for malaria? We get bed nets, we get mosquito highly treated bed nets. We get diagnostic tools. We get treatment. We get indoor residual spraying. So if you combine the mosquito net with the diagnostic and treatment capabilities and the vaccine, you put all the one in it together, with chances of managing malaria is extremely high. Right now, malaria is one of the greatest causes of death in the country. About 30% of the mortality as a result of malaria. In Peking, them are the most vulnerable. So now I could say, the mosquito net here enough for the store. If they cover the Peking them. Them vaccine here enough for the ampule, na fridge. If they inside the Peking them arm.
But then still they shape the mosquito tends to belly woman them.
So
because first they would see belly woman the all away they come out clinic. But now when they see something like that.
Yeah. Almost with there 8.5 million people, yeah? We order 5 million bed nets. 5 million bed nets. So every woman, below woman or not, is if we ever forget mosquito nets. So what's happening? Now the distribution system now been the challenge. But what they do, they use the opportunity with these 300 days and bring can out for make sure say every below woman, you get top priority for get mosquito net. And we know they look at normal, we look see, in fact I just come on meeting just now. We want to celebrate every belly. Every belly woman will present insect in the hospital, we want to celebrate with them. And what it will mean for that is we forgive them all of what they need. We forgive them a bundle, a package we then require, we then will need for help them during the pregnancy. And clearly the mosquito net is one important piece of that. And every picky we born, if I go home with mosquito net, again we get plenty. So I talk to the malaria people and now not to something we for store. Yeah, they'll pull her out, and you know, see, as you use all the tools there, so we foresee the change. We foresee the reduction in the infection rate. We foresee the reduction in mortality. So again, just in the past 93 days, the initial data look very, very promising. You know, we get a lot of confidence, say, would they move in the right direction. For example, normally, by the 90 days old don't look so, you would expect about 168 million die in the country. Right now, we're able to record 85 deaths, but 85 too high. So what should they do now? They try
for the whole country?
For the whole country, inside these 93 days, 93 days, yeah, 97 days or 97 days.
Which district get the highest?
Well, we they looked at the data. We'll get for announce the data at the 100-day mark. But the highest, not for just be the absolute number. You can forget the denominator. Yeah? If 4 people then die na Freetown, it's different from 4 people then die in Nigeria. Yeah? Because 4 people then die out of 1 million. And 4 people then die out of 100,000. So the proportion, the impact is very different. So they look all of the data, they analyze, and now we're going to go present to the president. And then I may ask me, so Lord, do this. At the 100-day mark, we go meet them, we show all of the data, we tell them what's not happening. And the really good thing about this is we did try hard, let nobody not die. But if anybody die, we the audit, we the find out what's happening, what's wrong, what you do or not supposed to do. And what will happen? We not they wait for the end of year report, not the end of quarter report. That weekly, that day, we they collect all of the information. We say next week enough happen. So the remaining pregnancies we'll get, the press track they allow you for know that number day. So for example, if you get 90 pregnancies inside the district or inside the chiefdom, then you can't lose one per them. We find out what you will do wrong. We lost the one, but we also look at the 89 we don't left behind now. How we go make sure say we manage them. Let waiting happen to that one person, they not happen to the other. So the really cool thing about this, they wait for annual reports. We did same close to real time as possible. So what we don't do now, we don't expand. We network capability. All the DHM, TDM, and get satellite link now. And we try to make sure say all of the hospitals then get satellite link where we did know in close to real time what's going to happen, not so only for the local location, but for the whole country as well.
Okay. The program na special body talk program on the 300 days of activism on maternal and child health, where the Ministry of Health they support for bring camp toner and farm will yourself can add the voice part the program where I go call the number 077981981 or self you go now already democracy Facebook page and drop in your comments or questions or concern where you get as we get the Minister of Health Dr. Austin Dembi we go respond to una questions there and where they bring una to na this edition of the program. My name na Kaifa to contact. You can call the number 077981981 077981981 at the number for call or ask you questions or concerns we get as we get the Minister of Health Dr. Austin Dembi we go able for respond to una questions them or self you go now already democracy Facebook page or YouTube page or drop in the comments or questions there. So Dr. Dembi plenty concerns don't they come out from people now that the when they can go na hospital the how the healthcare worker then can talk to them, they ask for couple, can make them pay for some service them where the where governments they say na free, we don't get plenty concerns of them people in the so waiting go be response or waiting at the actions or thing the way the ministry don't put in place for system una able for address standing inside the 300 days of activism.
So that's a very important concern from Salon. And again, we know they take their concern and they lightly. First, nobody know they go to hospital by gladi business for go waka. Now no more way they get lights na Kabbalah. People can go waka for the lights, But normally, na trauma, na crisis, na they carry person go hospital either for themselves or their loved one.
Okay. So Dr. Dembi, let's take this call quick.
Okay, all right.
Hello, good evening. Name and who's the call from?
Good evening, Radio Democracy. That is Mombinia. Because computer.
Okay. Please come on your radio.
Yeah. Sure, yeah.
Yes, go ahead, sir.
Okay, so I listened to the program and I get attracted to the Honorable Minister of Health, Dr. Dembi, and he did a very good job. Unfortunately, I hardly call on here on the listening and absorb, but I just want to use this platform to really congratulate the Honorable Minister of Health and Sanitation. This one, some man in a cancer the program goes in chief medical officer, attending director, But just imagine middle of the day in the evening where the minister for the drive go home. And for me, I don't see a lot of changes because there are more recruitment of health workers. Like I say, challenges must be one or two health workers go ask for this, but the positive side of them is greater since our Honorable Minister take over. So I really want to congratulate me and staff them at the Ministry of Health for the good work that they do. And in this particular cause that the discussion for help between the LM comrade and go born safely, so it's like protecting the next generation of Sierra Leoneans. So me just on behalf of the entertainers them and me as somebody they follow, as I say, I want to always call, so I really want to use this platform to thank the Honorable Minister and let God continue for inspire and promote them more as we get love for this country.
Okay.
Thank you very much.
Thank you very much, Desmond Benya, for that call the way making the program. Yes, Dr. Stinde Biki, go ahead.
Desmond, thank you very much again. Then kind accolade there, so see not for me now for the whole team, and we don't work what they do, not to work what they ask for. Thank you, because if you expect that, at times you can be disappointed. You do some work because say not the right thing for do. You do some work because you feel say you they impact people in life. You they make their life a little different and better. So again, the first caller I've been talk about, I think say.
Okay, yeah, we get another call now the program. Yes.
Okay.
Hello, good evening. Name and where the call from?
Good evening, Constance. They call from Cambia.
Okay, go ahead then.
I just want to the line of the previous speaker for commend the minister. Minister is now one person we don't follow him since they take up that ministry. They don't do a lot, and when they talk today, you will see the reason why it's necessary to get a professional ministry. Say, for example, if you go take somebody in a mechanical engineer, you go put another ministry, or somebody don't know nothing at all about that profession. But today, so one thing is very, very sincere when it make a response and it provide solution to some things and way you need for get solution for. So I join that man for commend them and for make God guide and protect them, make it get the strength and more energy and wisdom for doing work. Thank you very much.
Okay. Thank you very much, sir.
So, Kaifa to artist for the kaya more often
Yes,
because
doctors.
again, artist that then make we able for wake up in the morning, we energize for go because at times we people and they complain no more.
Yes, so you they get the complaint directly from the people, and more calls they come now the program.
But
okay.
Anyway, but the attitude where somebody
Hello?
say
Yes.
okay.
Hello, good evening. Name and who call from? Hello?
Hello?
Good evening. Name and who call from?
Hello?
Yes, good evening. Name and who call from?
Kadi, I call from Freetown. I just made up the program anyway. I don't know who time have been start. But the small skyway I read, honestly, we tell God thank you for the health system in the country. The minister don't try, but there is more to do. You need to do a lot. We tell God thank you. You are glad before 9 hours go to the hospital and they dress the solar panels. I say, wow. So the light issue when they get when they complain either operation or any other emergency, we're not too sure if lights go there by the time you go down do the operation. I should say that one they don't settle or you don't they settle. We tell the minister thank you. However, I don't know if the minister gets anything for do with the health workers' salary because you don't put the infrastructure in place like they do now. They try, but if the health workers they're not well taken care of, you know, go feel like so much be done. The people will not be satisfied, honestly. So. I they talk to the minister, whatever it take we able to do. Let it make sure say the health workers the way they do the work, they're satisfied. So I've been to hospital, you don't say small, but something the way I noticed. We come to after we don't do the prescription for buy medicine, I just see them go and pull the medicine, then give me bill. So I just pay for the medicine. Because like you say, we person go now hospital not to gladness. Sunday you go, you are distressed, you know they by yourself. Anything where you feel say go settle the problem where you go with. Now you they concentrate on.
Okay.
Now sick person you ask the person better. So one, let the minister try for see how best they able do the health workers then. The status, the remuneration or whatever you call them. And that issue of what I say, I just see them come to medicine. So now that.
Okay, plenty. Thank you for that contribution there. Well, now we go hold on first to the caller so not get them again at the program for let the minister go able round up. Yes, sir.
Okay, so first about the attitude business we will
Yes.
begin for talk about again with the work on and really aggressively again now for let people understand say we did not this well body place nobody know they can they with gladness then they can with sorrow then they can they with fear. We main mission now for make sure say the people and get good health care service and then they get good experience. Then they walk out of the hospital with a smile on their face, even when they can, they would frown. Let them go back. Again, one of the biggest joy that way you will get now for lady in a markets, they shopping, then somebody say, na me nurse da one day. Na me doctor da one day. This na me lab person. This one. So again, it's so fulfilling. So with the big all of the healthcare worker them, this na also they win you sainthood. Now you earn you sainthood by the service way they give to the people. Again, I think say the other caller been very clear. Say you know what they do all this, get appropriate salary. Again, with the work with the government, with the work with Ministry of Finance, and ensure two things now they do. First, we they ensure say let me look for raise revenue for raise the salary them of we healthcare worker them. We they work very hard on that. Secondly, the people that we they pay, we government they pay, let them did it for do the work. So we they get a situation where some people and they will get PIN code They're not in at the workplace. That one is not right. You know, we get people that way they volunteer and they work all the old nets, other people and they will get PIN code, where they know they go to the workplace, the government they pay them every month. So we they look into that and they very, very aggressively. In fact, we don't call some people then for help with for investigate that. Then they go site by site, location by location, for ensure say all my way government they pay, they did it for do the work. Again, if they pay you for go do night duty, you not do night duty. Then pay 10 people in for day, 2 people in show up. If somebody die during that period day, not to escape you escape from work, you abandon ship, you abandon the workplace, you in fact contribute to somebody in death. Then they unacceptable. The last thing what they do now for the few PIN code and the government don't recruit nearly 8,000 people and since I don't there. Yeah? But we want to make the process very transparent and open. Right now they don't give you 3,000 new PIN code them for recruit. We want for the best people them, the most capable, the one that with experience will go able to provide value. Let them be the one that will they recruit in the healthcare system. This is not so liberal work, not so somebody for bills and somebody where people in life they not their hand. So we get an open, transparent, competency-based recruitment process. We don't open a portal. For the 3,000 position in Giri, in just a few days, over 9,000 people apply for the position across 13 different disciplines in the ministry. Not only that, the system, the algorithm, is able to pull them on and the information not look correct. It kick out 1,000 right off the bat. Of the 8,000 we left, they make sure so we create algorithm where they look the length of service, the qualifications we then get, all of their requirement, and we put all to that. You can on to about 6,000 people. Now then they on active interview for see them people that also we apply for make sure so they get the right skills for the work we do. So now that kind of work that we do, we manage the salary for improve on them. We manage that the work people and did it. We manage the new one and what they hire and the right people them. We do some other services there, like we just buy bus for the people, or we just buy motorcycle them for a lot of the people and for move them around. As we speak now at the bill, or with the government in permission, with the president in concurrence, with the bill facility home for 100 health workers in Abo, we make sure say all of the new hospital that will build, with the build 100 bed hospital in Moyamba, we can you go see. With the build the same thing at Pujong, with the build the same thing at Karine. All the hospitals are now, we make sure say we get housing associated with them for make life a little easy for we work people. If we not pay them, we will make sure say we give them all of the other amenities. I did talk to some party there now. The doctor them, first time we will get about, we will graduate about 30 to 50 doctors a year. Now we don't expand that to over 250 to 350 doctors a year. We will open a new medical school in Ajala, and we will build them hospital also for them. Again, as we do all of this, we will make sure say the quality of care for the people in our salon improve for the better.
Okay, so the 300 days of activism done 93 days. Waiting before we go say 150 days, I hope so we not go get any cases of more, as now we don't get 85 deaths of Bele woman, then we don't die inside these 300 days of activism. So how not go work for say we get the 0 deaths?
So like I say, last year before the same period, now 168 people then die.
Okay.
Now we don't reduce them to 85, but it's still too high. We go for 0. And what team will they do with this 0 now? Now football and call man-to-man marking. Man-to-man marking means any one case where we see any one pregnant woman, we deal with that pregnancy day. We provide all of the support with this pregnancy need, all the way to labor and delivery and post-delivery. And the pikin itself, we no don't do all this for the mommy. He born the pikin now. Between age 0 and 60 months, we lost her. If you lost the pikin that 10 day, then no problem for the pikin we don't lost, a problem for the mommy as well. So we tag the mommy and the pikin then together. And again, we don't see a 43% drop, actually 48% drop per infant mortality in the same period. Even though we get about 49% drop per the mortality in the same period. So we wait for the 100 days. The 100 days, we stop, we check all things. The next 100 days, we go for zero.
Okay.
We go for zero. And that 0 day, not to health work at the normal, now we all get them. Now we all have to play with part for ensure say every Beleoma we notice them. Every Beleoma we support them. Every Beleoma will make sure say we not come up here until then deliver safely. And we then deliver the baby safely. We jump on the baby now and make sure say the baby it thrive.
Okay. Plenty thank you for joining at the program. Well, Fambul, that's now the Minister of Health, Dr. Stindembi. Every day today now the special well body talk on maternal and child health on the 300 days of activism where the Ministry of Health is support for bringing camp to now. Well, now this edition of the program special well body talk on the 300 days of activism on maternal and child health where the Ministry of Health is support for bringing camp to now. Plenty thank you to the one that we call, ask questions, make them concerns and contribution, and plenty thank you again to DJ Songa for in technical support. Mary Kamara Bango and make una watch you live on our Facebook page. Musa Kamara we produce the program and me will present this edition of the program. My name is Karifa to concert. They say don't forget for listening next week Monday 5 to 6 o'clock evening time. Bye bye.